This is a story in the beginning about a previous resident at the University of Michigan Hospital. I was residency director several years back, and I think confidentiality is very important. I want you to know that this resident has given me permission to share her story. We're going to go over 2 illnesses that occurred that were life-threatening. And I want you to think about the communication in the illnesses. We need to be sensitive to our patients and their needs that change as they age. Think about the communication through each illness. My goal is to bring you closer what some of your patients, their families, are going through at different points in their lives, no matter what their disease is. This is the patient, 1968, age 9. How many of you were even alive in 1968? Raise your hands. We're going to be asking you a question in a few minutes. What was going on in 1968? I'm sure many of you remember Martin Luther King died in 1968. He was assassinated. Known for I Have a Dream. We'll get back to dreams. The Vietnam War, full force. And the Beatles, they were actually on their decline in 1968. What was going on with this resident in 1968? She went to the emergency room with right lower quadrant pain, nausea, and vomiting. What do you think they told her the diagnosis most likely was? Appendicitis. So they did a McBurney incision, pre-laparoscope, and this is what they found: her right ovary, over 10 centimeters diameter. Any histopath lovers in the audience? What type of tissue is that? It's neuro tissue. Malignant brain tumor. Any thoughts about what type of tumor she has? It's an immature teratoma. So they didn't tell her. They told her parents she had 2 months to live, and then later when she was alive at 2 months, they said 6 months. They thought that the last 6 months of her life should be happy and not filled with cancer fears. What did they tell her? They told her she'd had an appendectomy, which wasn't a lie. They did take that out, but not a total abdominal hysterectomy, bilateral salpingo-oophorectomy. And in the late 60s, chemotherapy wasn't available for the germ cell tumors, the malignant tumors. And so what did they do? They gave her radiation therapy. We don't even use cobalt radiation therapy anymore, but this is where the senses come into it. To this day, the previous resident could tell you what that room smelled like, what it looked like, what it felt like. It was a cold, isolated room. Why didn't she ask about cobalt for appendicitis? Why not? She was only 9 years old. Every day, her mother and she would drive for the radiation in the Plymouth convertible. And every day at the same time, any Simon and Garfunkel fans out there? All right, The Sound of Silence would play. Listen to some of these words.
Hello, darkness, my old friend. I've come to talk with you again. Because a vision softly creeping left its seeds while I was sleeping. And the vision that was planted in my brain still remains within the sound of silence.
I've come to talk with you again. People talking without speaking. People hearing without listening. No one dare disturb the sound of silence. Fools, said I, you do not know. Silence, like a cancer grows. She was on an elevator going down to radiation therapy on the bottom level. Why is that always on the bottom level of hospitals? They announced over the PA system that Robert F. Kennedy had been assassinated. Anybody know where? LA, by Sirhan B. Sirhan. Well, she didn't die in 6 months. She was about 2 months away from that 5-year mark where her parents were going to tell her about the ovarian cancer. She developed nausea, vomiting, abdominal pain. She presented to the emergency room with severe dehydration. The intern walked in and said, so you had your uterus and ovaries removed for ovarian cancer. She looked at her mother and said, "Is this person in the wrong room?" And her mother said, "We'll discuss this later." And the intern started an IV with sodium and potassium for her dehydration. And as the IV was started, she looked at her sister, her father, and her mother that were in the room with her and said that her arm was burning. This is what her EKG did. Normal sinus to asystole. They coded her. She was seizing. They intubated her. They put her on anticonvulsants and transported her after they had cardioverted her and gotten the heart going again up to the ICU. After she stopped seizing, 12 hours later, they got her stable enough to take her to the OR, expecting to find recurrent cancer. But instead, they found a bowel obstruction, radiation damage to the bowel. The good news is there was no evidence of cancer. As you can imagine, her mother and she had a long discussion when they left the hospital. Next, I'd like to introduce a very special person, Barbara Getty. Barbara and I have been working together on the Childhood Gynecologic Cancer Association for several years. I'm happy to say, got our 501c3 in February last year, which was a day to celebrate. Barbara.
So now we'd like to go through some patients. And the first person I'd like to introduce is the mother of the patient that Hope has been talking about.
Go back to the day you were told about your daughter's cancer. How did you feel about her having a cancer at such a young age?
Complete disbelief, utter disbelief. It was an impossibility.
How did your family handle the cancer diagnosis?
Well, that's a hard question to answer. We cried and tried to figure out the best way to go ahead to make her comfortable and happy.
How was the communication with the healthcare providers?
The gynecologist that was in charge of her case was a quiet, kind of blunt man, but very kind.
What about the other healthcare providers in his group?
Well, one of them was not very helpful at all. He said, well, she can't live. Well, there's no sense in your trying all these things that you're suggesting, and that it's just not going to work. So I refused to talk to him anymore because I didn't believe as he did.
How did your husband handle the diagnosis of cancer in a young child?
Terribly. He just was, he'd never heard of such a thing, of course, and he couldn't handle it for a while.
Did you have any fears?
Of course I had fears. Why wouldn't I have? It was something very hard for a mother and father to go through. She was our baby.
The diagnosis was not initially shared with your daughter. What are your thoughts on that?
I think we did it because we wanted her, as I've said before, to have a normal life, as normal as possible. And we didn't want her to feel that she was so different from other children.
Would you recommend it be done differently now in 2012?
Thinking back, no. I wanted my daughter to have whatever time she had in a way with her friends and her family that was like everybody else, and she did, so I wouldn't change it.
The next person I'd like to introduce to you is Michelle Woodhams. If you could come up, Michelle. I really appreciate Michelle coming today. She is a nurse and the mother of a patient of mine who had a vulvar melanoma. I'm going to ask Michelle a few questions coming up.
Thank you.
Welcome.
Thank you.
So if you could go back to the day when you were first told about your daughter's cancer, what were your reactions, your emotions?
Fear. I knew that there wasn't a lot of patients at her age. She was 10 at the time that this cancer occurred in. And with it being melanoma, it was scary because I had already had friends and some family that had passed away and were trying to battle melanoma. And kind of just wondering how this could happen in a 10-year-old.
How did you communicate with your family about the diagnosis?
We were pretty open about it. We kept stuff in the family when it came to describing what was going on outside the family, like with school. We tried to keep things normal with Anna too, and we didn't really say where it was, but she knew, and she was very, she took on a huge responsibility at being 10 years old with checking herself and everything, so.
Would you recommend anything be differently done than it was at that point in time?
Not at that point, but in the beginning, it was Anna, my daughter, that found the spot on her vulva, and the first person that we went to was a GYN, OB/GYN specialist who kind of just pushed off the idea that there was really anything. She said, well, I'll check with my colleagues. So I would say that you would listen. Someone would listen in the beginning, because time went on, and if I hadn't questioned again why we hadn't heard anything back, I don't know where we would be, because probably close to a month went by before we finally had the biopsy. So it's listening to the patient and the family.
What fears and concerns did you have as time passed on?
Reoccurrence, 3 surgeries, and
And a grind dissection.
yep. And then a year of we used interferon, and at first they weren't even going to offer that option as an adjunct for treatment of it, because it was just surgeries that she had had at that point. And so it was just a fear of reoccurrence, and that went on, and it still goes on in my mind, because you worry about the belly aches and stuff that she was feeling, you know, in her limb where she had the lymph nodes removed. So,
What's Anna doing now?
she's a junior studying psychology at Western Michigan University.
And you see Dr. Reynolds is in the audience.
I do. Thank you, Dr. Reynolds. He was one of the fabulous doctors here, along with Dr. Haefner. So,
Any tips you could give us healthcare providers about communication to children and adolescents with gynecologic
that's it,
cancer?
just listening to them. And you have to, of course, approach it from a different level, which is challenging, especially when gynecological cancer in children is not real common. I mean, I think we're seeing it more, perhaps, like we're seeing other diseases in children, but just to be open and honest and involve them in their care, which Anna was, and be open to them and their feelings, their culture, their being as a person. So, and the thing about the siblings is very important, because Anna does have an older sister who was right there with us, and it's amazing but sad that people will still come up to me and say, "How's your daughter?" And they've totally pushed Anna's sister out of the picture very early on. That, you know, I know they were concerned about Anna and how she's doing, but I always would say, which one? Because we tried to keep Haley involved too, so.
Thank you so much.
Thank you.
So our next interview is Lauren. She's a 17-year-old survivor of unilateral ovarian dysgerminoma.
I'm Lauren McCula. I'm 32 years old. I live in Royal Oak, Michigan, and I had ovarian cancer in 1995 at the age of 15. I was a freshman in high school, and I underwent surgery and chemotherapy at University of Michigan Mott Hospital.
So discuss your age at diagnosis. How did you feel about having cancer at such a young age?
I always say that I was kind of a blessing to be that young because I was old enough to understand everything that was going on, but I was young enough to be very optimistic and bounce right back. I wasn't aware, even when I was at Mott, that when I was transferred, that cancer was a possibility. I don't remember exactly when, but I remember being in a CT scan and realizing that I might have cancer, and I don't remember if I overheard it, but a lot was kept from me until there was a lot more information.
When you think about that experience, what went well, what did not go well?
My parents tell me that the surgeon placed the Metaport a little lower so that my bathing suit might cover it. It was the summertime, so that was very considerate for a 15-year-old who's going to be hanging out at the pool. No, I mean, it was really, I don't have any, I have mostly positive memories of my time.
Did you tell your friends about the ovarian cancer diagnosis?
Oh, absolutely. I was a freshman in high school. It was all girls school, very small, so they all sent me notes and cards, and one girl was an artist and she made me like a little comic book with me as like the superhero. So they were all very caring, and there was an outpouring there, so that was good.
As you went through the experience, what fears did you have?
I think a lot of them. I remember being concerned about dying only once. That was a fleeting feeling. And then the other fears I really remember are more body image type fears, like losing your hair and maybe losing weight and things like that. I did go out, and my parents and we got a really nice wig that looked just like my hair. And when the time came that I started to lose my hair, and it was itchy and uncomfortable. So by that point, I really just wanted it gone. And my brother shaved my head for me, and I actually liked it and wore bandanas and hats. And I didn't use the wig once, except for Halloween that year. I brought it out, so it turned out.
When time passed, you went into your 20s. What fears did you have in your 20s about your ovarian cancer diagnosis?
I was thinking about this, and at 15, right after I went through everything, I felt strong and very proud of myself, and it's kind of on a high maybe for a year or two, get back into your swing of things, and you feel great, and then reality kind of sets in down the road, and these fears kind of come to the surface, and I started to fear, could I get pregnant having one ovary? If I did get pregnant, the egg having been exposed to chemotherapy, would that cause any problems with the baby? Would I pass along, because we don't know why I had the cancer, so could I pass on this to my children, and so on and so forth. Ultimately, you always have a small fear that you could get cancer again. It's been 17 years, and there's still small worry about that as well. So the fears almost are worse, I think, now than they were when I was younger. And luckily I had a baby boy last November, so that was good. That was wonderful. And I was worried throughout the pregnancy about his health and if I should have genetic testing and things like that. And I was worried about a C-section, and if that were to happen, would there be an issue with my laparotomy scar and adhesion? So I had fears about, a little different than the average pregnant woman and as a patient.
Are there any tips you could give healthcare providers in dealing with children and adolescents with gynecologic malignancies?
I think just to be sensitive to their different needs, and possibly body image is a big one, or it was for me. Just be caring and sensitive to those differences.
I'd like to tell you now about Marielle Almendras. Her mother was invited to come today but had to be out of town, so she's sent me the picture to share with you of Marielle. She was born December 6, 2002, and died November 24, 2011. That was Thanksgiving Day. I remember reading about her death. She died of a sex cord stromal tumor of the ovary, a Sertoli Leydig cell tumor. She received much of her care here at the University of Michigan Mott Hospital, of which her family's very appreciative. She also went down to MD Anderson. You see a picture of Marielle here with the teal ribbon. That's the ovarian cancer color, teal. And once a year in September, families of ovarian cancer patients who have died, survivors, and friends tie the teal ribbons on trees. And I had the pleasure of doing that last September and met with the family of Marielle. We'll forever be thinking about her. Patient decisions are not always clear-cut. We often think about the patient as a body, that C-section patient, that other patient that had the hysterectomy. But we're not hearts, we're not lungs, we're not kidneys. We're individuals, and each individual is unique. Some are complex, others are very simple, and we change throughout time. We use the senses whenever we're dealing with our patients, particularly the seeing, the hearing, and the touching. Our senses help us learn about the world around us every day when we're communicating with our patients. I'd like you to now open up envelope number 1. There's a couple of papers I've written that have had the most impact on others. And one of them is the first paper there called A Dream. This was published in JAMA. I wrote it in 1990s, early 90s, shortly after I finished my residency. It's a story of the patient, the resident I told you about. In the paper, her name is Kathy. Catherine's my middle name. It's my story. I wasn't sharing it at that time. I think I've come a long way. And I think a lot of cancer survivors, particularly the children and adolescents, at times are hesitant to share their stories. But I find that it really helps others and the patient to share. We've made advances in ovarian cancer. In the 50s, it was 10% survival. 70s, after chemotherapy came out, 58%. And now we're up to 95% survival. What's your 1968? Many of you in the audience have illnesses that are much worse than what I've talked about. Family members, friends going through something right now. My mother, to this day, as you saw on that video, will tell you that the right thing had been done by not communicating. I don't always agree with my mother. What were you thinking when you moved through all these sections? What were your reactions? As you listened closely, what thoughts crossed your mind? I'll tell you what I was thinking. I was thinking about the encouragement that the minority gave me. Dr. George Smith, if you look at all the old photos in the hallway of medical students here at the University of Michigan, he's on one of them. He was the only one that gave the patients that had cancer any sense of hope. And I think about my parents. It was very stressful on them. They were near divorce many parts of those weeks. And then I think of the illness it's had on others. My sister, it was devastating. Actually, I think she had it worse than I did. And my brother, well, he was in the hippie generation and nothing really affected him. I do have to say, I got an email from Hong Kong the other day with a donation for the Childhood Gynecologic Cancer Association. When I looked up the name, it was a photographer. My brother's a photographer. And I think it did affect him. He was at a meeting talking with others, showing them the website. I think about what Barbara and Bob Getty have done. Bob manages our website day in and day out. I think about the stories you've heard from Lauren about Anna Woodham. And then I think about Marielle. I told you I'd talk about dreams very briefly. The night I arrested from the bowel obstruction and probable potassium overdose, I was supposed to be at band the next day, and my best friend, Sasha Montross, awakened at the exact same time I coded with a nightmare that I had died. And when she got to school and I wasn't there, she panicked. I'm very, very fortunate. A defibrillator happened to be in the ER when I arrested, and I'm lucky. You've already heard me talk about my precious children, and I'm lucky for the support that my husband, Michael, has given me throughout. We all go into medicine for different reasons. Think about your most memorable patient. You're a good listener. We all can be better listeners. We, as patients, do a very poor job rewarding you, the healthcare provider. This is a quote from Jason Bloom. Listen to that voice inside you that says you can accomplish anything. Trust that feeling that tells you you can achieve all that you ever hoped for. Believe that everything you want is waiting for you, and hold on to the knowledge that nothing is impossible. Remember, each person who's ever achieved a goal started out only with a dream. Dr. Gosling was a major influence on my life. He would tell you, don't undermine your worth by comparing yourself with others. It's because we are different that each of us is special. Who's perfect? The world's not perfect. I'm not perfect. You're not perfect. We all have something to give. I'll let you read the last few slides.
Let it go. Let it roll right off your shoulder, don't you know? The hardest part is over. Let it in. Let your clarity define you in the end. We will only just remember how it feels. Our lives are made in these small hours, these little wonders, these twists and turns of fate. Time falls away, but these small hours still remain.
I thank you for sharing your thoughts on childhood gynecologic cancers. I'm honored to have spoken to you.